Hiya.
Hello.
Hey, so if you'd like to introduce yourself to the students and tell them a bit about the role that you're going to speak about.
Okay, so my name's Debbie Morris and I currently work as a Learning Development Manager at Sherwood Forest Hospitals. However, before that, I worked for over 25 years as a pharmacy technician within the hospital environment. So I'm going to talk to you about a pharmacy technician and what that role involves really.
Okay, so what does it involve?
I think really most people associate pharmacy technicians just with dispensing prescriptions.
Mhm.
So if you were to say I work in a pharmacy, most people would think about Boots the chemist and think that, you know, perhaps it's quite a boring job. We do elements of that. I'm not going to say we don't. So part of a pharmacy technician's role would be to label prescriptions, to dispense prescriptions, and to counsel patients on how they take their medication. But also as a technician, you would be expected to accuracy check prescriptions. So what normally happens on a prescription is the pharmacist would look at it to make sure that clinically it is correct, that there's no interactions between the medication or no allergies or anything involved with that, make sure that the dose is correct. And then it would be labelled and dispensed. And in a hospital, 99% of times it will be a technician that would then check the final prescription, which is quite a responsible role because you're the last person to look at it before it's given to the patient and they take that medication. However, a lot of a pharmacy technician's role now has moved to working on the wards within a hospital environment, which is, I would say, a lot more interesting and more enjoyable. So it would involve looking at patients' medications, performing drug histories, ordering medications, contacting doctors if there's any issues with the medication that's prescribed. So it's very much a ward-based role rather than a dispensary-based role.
Yeah. So when you were doing that role, how did you fit into kind of the organisation?
Yeah, so we have the whole of the pharmacy department. So most hospitals will have their own pharmacy department. And within that, there's different areas within pharmacy. So again, most people only ever see the dispensary side of it.
Yeah.
There is also in most of them a pharmacy stores who are responsible for making sure all those medications are on the ward. So without the pharmacy stores, the medication wouldn't be there when you need it. Yeah. So we have a team of staff who go up and check that and make sure that they've got the medications up there. They're also responsible for doing all the orders and the contracting of the medicines. And then the other two areas that some pharmacies will have, but not all of them, will be the non-sterile manufacturing unit. So that's where they would make bespoke prescriptions that need to actually be made up. So creams, if you needed a liquid, so say they wanted to prescribe a medication for a child, but it's not available in a liquid form, then it would be the non-sterile manufacturing department that would create a suspension from crushing down the tablets. So you would crush down the tablets and mix it with water and put it in a suspending agent. So it's very, very scientific measuring, weighing. They might make powders. So you grind it down and mix it with lactose and then weigh out the powders. They could be doing creams. So that could be grinding down a powder and then mixing it into a small amount of cream before further diluting it. So it's actually making products that are one-offs basically. Yeah. And each of them, so for that you've got to be involved in writing the drug formulas out, working out those formulas. So if it's a 2% cream and you've got, you know, 100 grams, then that'd be 2 grams of say dithranol. And then
that sounds
100 gram. Yeah, so you've got to write those formulas out and then do weighing it on the proper electronic scales and with the glass slabs, pestle and mortars, good old fashioned. Yeah, I used to enjoy that, but I didn't do it for very long, but I did enjoy that.
It sounds really, really good.
Yeah, and then the other side of it is the sterile production units as well. So that's where you need something that's needs to be sterile to go into an individual. So the most common thing that people would think about that is the total parenteral nutrition, which is the feeding bags. So when people are unable to eat for a period of time, so it could be because they're in intensive care and unable to eat, or it could be because they've had some kind of stomach surgery or throat surgery or something like that. So it's where you actually make up a feeding bag for them, and it goes into their into a central line and straight into their bloodstream to feed them. So it's a mixture of glucose and lipids and nutrients that they would need. And they all need to be measured again. In order to do that, you'd be doing that in a completely sterile environment. So it would either involve getting fully gowned up and going into a sterile room, or would be doing that in what's called an isolator, which has got pressure. So you put your hands into gloves in an isolator and you work in a completely sterile environment inside the sealed isolator. And you were drawing it up with needles and syringes and creating the bags. And the other thing that they do in that area as well, a lot of, is the cytotoxic medication that treats people for chemotherapy for cancer. So they will, again, a lot of that is working out the formulas according to metered square, body weight and things like that, and working out the strength of the medication that they need and creating those and then sending it up for it to be given at ward level.
Wow. So is that a typical day in that kind of role?
Yeah, it depends which one, you know, which role you would do. But for me, I was a ward-based. So what would tend to happen is that if you're a ward-based technician, you would be given a range of wards. So you might be given sort of 2 or 3 surgical wards or medical wards or orthopedic wards. So you have 2 or 3 wards per day to look after. And you start the day by going up to the wards, looking in the diaries, communication diary for anything anybody's requested urgently that you need to deal with. Then you start to look at your new admissions, so who's new onto that ward from the previous day. Those people are probably going to need their medication check-in, so you'd actually go to the patient's bedside and chat with the patient about what medication do they normally take, get the drug history from the patient. Have they brought the medicines in with them? If they have, check them. Are they labelled correctly according to what we've got on the drug chart? Are they in date? Can you confirm they're the correct drug? Have they got enough? Do we need to order some more? So you might find yourself then needing to order medication, which you place on an ordering form and send that down to pharmacy. You could then end up having to talk to the pharmacies in community where they normally get their prescriptions from to confirm their drug history, or you could be ringing up the GP practices to confirm drug history to make sure everything that the patient is on is correct. What we don't want to be doing is missing out any medication whilst they're, you know, on the ward. So we do all of that and make sure that they've got the medicines they need. Then we'd be looking at who's going home. So who's now wanting to be discharged from hospital? So have they got the medication that they need, or do we need to order anything else? Counselling the patients on those medications, particularly if they've had anything new prescribed or they've had any changes to their regular medication whilst they've been in hospital. And then lastly, we'd be reviewing those ongoing patients who are in, and, you know, have they had anything new prescribed? Are they running low on any medication? So you spend your time basically going around each of the patients on the wards for the day and ordering the medication. But you would often then have a session down in the dispensary as well. So you probably have at least, you know, 1 session a week where you'd be doing some accuracy checking, and you might have to cover some labelling and dispensing as well.
So very varied role.
Yeah, you've got to be very organised doing it to fit everything into the time scale.
Yeah.
And very sort of methodical to make sure that you don't miss anything really.
Yeah, it's not a job where you can mess things up.
No,
really.
but it is quite interesting, and you do get to speak to the patients, which again I don't think many people sort of think that staff in pharmacy would do.
Yeah.
And then in terms of the staff that are in that pharmacy department, there tends to be 3 main levels. So we have the pharmacy technician I've just talked about, which tends to be the middle level of pharmacy staff. And then there are pharmacy assistants as well. And the assistants are the one who tend to do a lot of the labelling and dispensing and the receiving of prescription and the topping up of stock items up on the wards, that kind of thing. And then above the technicians, you've then got the pharmacists. And then the pharmacists, again, do tend to be more ward-based, but they tend to be doing the drug rounds with the doctor. So advising the doctor on medications to prescribe, and double checking drug histories, and making sure clinically that all the prescriptions are correct. So you've sort of got the 3 levels. So that's the other thing, really. Most people, when they think about pharmacy, think pharmacist.
Yeah.
And they think, I'm not clever enough to be a pharmacist. I can't go to university and get a degree and that kind of thing. Whereas you don't have to. You know, you could enter as a technician, or you could enter as an assistant.
Okay.
And the different sort of levels.
So how did you get to be a pharmacy assistant? Sorry,
technician. Yeah, so I went in at technician level. So I was always quite scientific minded at school, I suppose. I liked my science and I liked my maths. They were my favourite subjects. And I did my O levels in my day. That's how old I am. I was the very last, can I say I was the very last year of O levels before GCSEs came in, but I did my O levels. And I stayed on to start my A levels. And I was doing maths, biology and chemistry at A level. And I knew that I wanted to work in a hospital. That was where I thought I wanted to work, something scientific. So I thought, we're better than a hospital.
Yeah.
But I knew I didn't want to be a nurse. I couldn't, I doff my cap to anybody who's a nurse. I couldn't be dealing with bodily functions and blood and anything else. That wasn't what I wanted to do. So in my mind, I was thinking maybe lab work or something like that, but I wasn't entirely sure. And it was back in the days before internet, So if any of your students can even remember or imagine life without internet. But all the jobs used to go into the Evening Post on a Thursday, and it was job day in the Evening Post. Yeah. And the Queen's Medical Centre at Nottingham were advertising for a pharmacy technician, qualified, if not would consider student. And it was my mum who actually saw it and went, "What do you think to this?" And I thought, well, yeah, it's quite science-based, and what they asked for was for you to have maths, English and a science subject at O level.
All of which you had.
All of which I had. And part of it was they were going to train you to be a technician. You got to undertake your level 3 BTEC in pharmaceutical sciences, which was equivalent to 3 science A levels anyway. Okay. So I went back to my school and discussed it with the careers advisor at school. And at the time, I sort of went, I don't really think I want to go to university. I was 16 at this point. And not very past 16, really. I wasn't even 16 and a half. I was still I was a youngster in the class. And I didn't see myself going to university. So I discussed this option with him. And he said that if I wasn't going to go to university, I would be better off going and starting my career and getting a vocational qualification, as long as there was still some training involved, going and getting that vocational training and getting some work experience at the same time. So I went for the interview at 16 years old, was very, very nervous. I think I was bright red everywhere. I was so nervous, it was untrue. Had the interview. My parents didn't drive. Obviously I was 16, I didn't drive, so I had to go there and get there on the bus. And they called me back before I'd even made it home. So I had to call them back, and thankfully they offered me the post. Amazing. So I started age 16 at Queen's Medical Centre as a student pharmacy technician. I went to, I do believe it is Nottingham College now. It was People's College at the time. Is that Nottingham College at the bottom of Maid Marian Way? Yeah. So that's where I went to study my BTEC in pharmaceutical science. I had to go on a Tuesday straight after work, and for 2 hours, and I had to go all day on a Wednesday for about 10 hours. And I did that for 2 years, and then qualified as a pharmacy technician, and then started my career from there, really. So whilst I was training as a student, I rotated through all those areas I mentioned before. So I went through non-sterile, I went through sterile, I went through stores, and I went through the dispensary. And once I qualified, I continued to do that for another year to 18 months. And then I decided to specialise in the pharmacy area. So I became an accuracy checking technician, and then a medicines management technician, and then a senior technician.
Wow. So you've spoken about all the different roles you had within pharmacy. Was it easier or harder than you expected to get to that position?
It took a bit of time, I think, but it was it took a bit of time to progress. But I wouldn't say it was hard. I think within pharmacy, once you've done the initial qualification, moving on from there is more about career progression and internal training rather than gaining more qualifications as a technician. So it was about passing, there are a lot of what's called validations. So it sets standards. So you go through training packages to be able to do the accuracy checking. And that was quite nerve-wracking the first time I did that. I remember thinking, oh, I've got to get this, looking at it like 100 times before I'd let a prescription go, thinking, this is right. I know it's right, but let me just double check it. Let me just double check it. Because I was just so nervous about that side of things. And then going onto the wards and doing that role to start off with was quite daunting. But, it's just moving with the times, and we have to constantly move, we have to constantly evolve, and you have to develop with that, don't you? Because everything we do to make everything more efficient for the patient. So looking at becoming medicine management technician and doing that work at ward level makes everything a lot easier for the patient. They've got the medicines when they need them, rather than having to wait for somebody to send an order down and us to do it and send it up. And we're there at the point we're using their medication, so they're familiar with that. So there's reasons why we do things. And then when I moved from Queen's Medical Centre to Sherwood Forest Hospitals, I moved to basically set that system up, which was interesting because they didn't operate that system at all when I joined. They had pharmacists doing the check-in, and they had no real ward work, and certainly not with technicians, only a little bit of pharmacist ward work. So it was interesting having to set up a new system and devise training packages, and I think that's where my love of training packages
I was just going to say, yeah, it probably started there.
Yeah, it probably did. Yes. So no, I wouldn't say it's not hard, but it is hard work.
Okay.
I would say.
Have you got any tips?
I'd say really, if just go into it. If pharmacy is something you're interested in, then you can start at any level. And I would say that pretty much of most clinical jobs within the NHS. So most people see a job and think, I want to do that job, and are put off by looking into it any further because they think that they may not be academically clever enough for that role. And that may be the case, but for every profession that there is within the NHS, there is almost always a supporting role. So you think about an OT and a physio, we have therapy assistants. You think about radiographers taking x-rays, there are imaging assistants. You think about the nursing staff, the healthcare support workers. So if you've got an interest in a particular area of medicine and you think, I'm not academic enough to do that, don't just dismiss it. Look into it and see what other roles there are within that area. So there's biomedical scientists, but there's medical laboratory assistants. So, there are roles out there. And I would say to people, if you've got an area that you're interested in, look into it a little bit more. Ring the place up and just say you're interested in that kind of work. What roles are there, in that area? Just, do a little bit of digging, really. So, to get into pharmacy itself as an assistant, you would come in, and really we don't ask for any formal qualifications. to start as pharmacy assistant, and you would be put through a level 2, which is your equivalent to an O-level type pharmacy qualification. And then as a technician, you know, we ask for you to have that sort of GCSE passes, and you will be put through that level 3, which is your A-level equivalent qualification, and then you've got your pharmacist.
That's
so
really good advice.
Look at it. There are so many roles, and it's not just the big ones that you actually see, or even what you think you see. You probably see somebody and you think that they may be an OT or a physio, and it might actually be an assistant. It's just your perception, you know. So that would be my one big tip to anybody. If you're interested in it, don't be put off from a career in the health service because you think you're not academically clever enough to do it, because you can get in, and often when you're in, then as the NHS, we can help you to support you to grow if that's something you want to do, and develop yourself through other routes, through more vocational training and apprenticeships, to develop yourself further. See, that's my training bit coming out of me
exactly.
Again
You're
Just
right.
Can't stop myself.
Many ways to skin a cat is basically what you're saying.
Yes. And I think all too often people think that, you know, university is the be all and end all, and if they don't get into university, then that's sort of the end of their career.
Yeah.
And you know, I would say that my careers advisor was totally right back in 1987, way back when, because I have a cousin who is exactly the same age as myself, and she stayed on to do her A-levels whilst I left and started my career. And at the end of her A-levels, she decided that she didn't want to go to university and do what she was going to do. So she then joined the NHS, working in the labs as a trainee medical laboratory scientific officer, so equivalent of biomedical scientist. And she then did her level 3 and her level 5. But I was always like 2 years ahead, because I'd started my career beforehand, because in effect she did her A-levels, which were level 3 qualifications, but then she had to do her level 3 in biomedical science, and then her level 5, and then her degree. So I do think that that's the right advice. So be careful in your career choices, I think, and think about, is academia the way for you all the way, or do you want to go on and do to college but then move on to vocational? But thinking that if you get into the world of work, that's not necessarily the end of your educational career either.
Yeah, exactly.
There are other options available.
Yeah, so you have to basically look at where you want to be, if you know your destination, and are there other ways to get there?
Yeah, what different routes can you take? Yes,
exactly.
And what will suit you as a learner, really.
Exactly.
And that to me is the key thing. I've got a business admin apprentice that we had in our organisation. We took her on as an apprentice, so I won't name her name. But whilst she did that, some of her friends went to college to do business admin at college. She's now gained a permanent post in the NHS, working as a band 3, which I think is a really good wage. And she's only, 17.
Yes, enough money for a 17-year-old.
A lot of money for a 17-year-old, yeah. And so she's now able to go on holiday, buy herself a car, but she's not, it doesn't mean that she's got a job and given up on her education. She's still getting that education through her apprenticeship, and at the end of it, she will still get that level 3 in business administration.
Yeah, amazing. That's really good. Is there anything that you'd have done differently within your career as a pharmacy technician?
Not within my career as a pharmacy technician, I don't think there would be. Having said everything I said about not wanting to go to university, I also think that maybe at 16 you're not too sure what your life choices would be. So in hindsight, I may have gone to university. I think my thing was at 16, I didn't feel ready. The thought of going to university was very scary. And I think when you're 16 and you have just left full-time education, you've not really experienced the world too much. And I think your experience of academia between the ages of 16 and 18 are very different to 11 to 16, if that makes sense. You do grow up and you are treated different, whether you stay on at school or whether you go to college. It is a different experience. And I think if I'd have done that 2 years of that different experience, by the time I got to 18, I may actually have wanted to have gone to university then. But at 16, I was adamant I wasn't going. I was quite a homely child, should we say, not very worldly wise, you know. And so the thought of leaving home, going to university, doing another 4 years of study, or at that point it was 6 years of study ahead of me, was quite scary. So I'm not saying that I made the wrong choice, because it's got me where I am and I'm very happy in my job role and I've enjoyed my working life and my working career. And I think if you can say that, you're doing well. I think a lot of people are in jobs that they don't like and they don't enjoy, and never once have I said I don't like pharmacy and I don't like training. So I wouldn't say I've made the wrong choice, but had I not left at 16 and had I stayed on at school, I may have gone on to university and then done a different career path, possibly.
Maybe, maybe not. Who could say?
Maybe, maybe not. I like maths, so I think I might have, like, you know, gone and been an accountant or something like that, maybe. But at the time,
choices that you've made, so
exactly, you can't look back in hindsight. But I wouldn't say that I'd have changed anything, but it would have been interesting to see. And just a little thing to people that, you know, you do change a lot between the ages of 16 and 18, I think, as people. So any students who might be watching it, just think about that, really, and think about, I think it's very much as you said, Nadine, about how do you learn and how do you think that would suit you best?
Yeah, make it work for you.
Yes, definitely. Definitely.
Are there any resources that you can point the students in the direction of, whether that be books, podcasts, anything?
There is a bit around pharmacy. I do have a book I would definitely recommend if anybody is studying pharmacy, and that would be the British. I've had to write it down because I can never remember the proper title. The British Medical Association New Guide to Medicines and Drugs. It's brilliant. It goes through drugs and how they work in a very simplistic way. The obvious book, if you're going into pharmacy, is a book called the BNF, which stands for British National Formulary. It comes out twice a year and it lists any drug that is available to prescribe in the NHS. And it will go through what they're used for, any side effects, contraindications. This other book doesn't quite go through every single one, but it goes through a lot of the main ones, but talks about it in a lot simpler way. So if you're new to it, it's very easy to understand. If you're looking into any kind of training, there is a specialist company. I don't know if I'm allowed to mention this company or not. You can put it out if not. Buttercup's training are purely dedicated to pharmacy training. So they've got, and they've got some that you could just fund yourself, you know, so that it's quite good if you just want to get an insight to it. And obviously there's also the General Pharmaceutical Council as well, has got lots of information.
Amazing.
Around pharmacy as well.
Thank you for all of that.
Okay.
That's really useful. I will put all of that with the video so the students can go and have a look at it all.
Okay, okay.
Amazing. Thank you so much for talking.
All right. Okay. Thank you. Bye.
Bye.